Joints are classified into various types, and there are some examples which we need to memorize. You see, this is one question asking inferior tibiofibular joint. What do you think is the answer? Inferior tibiofibular joint, it is slightly mobile joint. Now, if you say it is slightly mobile joint, tibiofibular joint, it's a fibrous joint. But if it is a fibrous joint, what is the answer? Answer is syndesmosis. Why? Because desmos means fiber. Desmos is fiber. Now, when you say desmos is fiber and it is a fibrous joint, syndesmosis, what is chondro? Chondro is cartilage. It's a primary cartilage joint. So, synchondros is primary cartilage joint. Then what is symphysis? It is secondary cartilage joint. The symphysis is secondary cartilage joint. And what about the sphenoidosis? Sphenoidosis, one example will take, it is at the roof of the nasal cavity, there is a suture, sphenovomerine joint. So, you are telling that sphenovomerine joint at the roof of the nasal cavity is a sphenoidosis. Can I see a diagram for that? I will see the diagram, but it is here. See, this is nasal septum. From the front view formed by the vomer bone from below, and then you have sphenoid bone from above. What is this? Front view of the nose, and you are looking at the nasal septum. So, vomer bone from nasal septum from below and sphenoid bone is at the roof of the nasal cavity, and we are talking about this suture, sphenovomerine joint. Actually, you will see vomer bone has split like this. This is called as ala of the vomer. This is ala of the vomer. So, that is the ala or wings of the vomer. This is vomer bone. And what is going into that ala of the vomer? The spine of the sphenoid. This is rostrum of the sphenoid. So, this is the sphenoid bone here. Yes. And giving a rostrum like that. Yes. It is sphenoid bone and giving a rostrum like that. So, there will be a sphenoid bone which will be a rostrum like that, which will be fitting into the ala of the vomer from below. Yes, and that is a suture, and this suture is called as sphenoidosis. Anyway, if you say that is a sphenoidosis, sphenovomerine joint at the roof of nasal cavity, fine. What is the answer? To the inferior tibiofibular? Yes. Slightly mobile joint? Yes. Fibrous joint? Yes. Syndesmosis? Yes, syndesmosis. That is the answer. Now, when we move further, you will be classifying the joints. Classification of joint is varied, and sometimes you will say fibrous joint and cartilaginous joint. Let us look at them first. So, when you are talking about the fibrous and cartilaginous joint, they are themselves divided into further categories. Like you see, this is fibrous joint, and we are looking at the three type of fibrous joint. Let us magnify the first two. So, you are talking about three type of fibrous joint, and you are magnifying the first two. What are they? In the skull bone, you will see there is a suture, and in the skull bone, you see tooth and socket joint, which is called gomphosis. Now, remember, maybe it is gomphosis, the tooth and socket joint, or maybe it is suture. They are immobile joint. They don't move at all in the skull bone. And what about the third type of the fibrous joint? It is syndesmosis. One example of syndesmosis, we have taken inferior tibiofibular joint. One more, the middle radio-ulnar joint, middle radio. So, middle radio-ulnar joint is a syndesmosis of fibrous joint. Yes, it is slightly mobile joint, slightly mobile joint. And what about the cartilaginous variety? There are two types which we discussed, primary and secondary. Now, if you say cartilaginous, two type, primary and secondary, what about the primary? Primary is also called synchondrosis, if you remember. Chondro means cartilage, synchondrosis. Can you give the example of synchondrosis? Yeah, this is the one where you have epiphysis bone connecting with the diaphysis bone by some hyaline cartilage making the growth plate. You mean to say epiphysio-diaphyseal joint? Yes. And when you say epiphysio-diaphyseal joint, which is two bones connected by the hyaline cartilage, let's make a diagram for that. What you have to understand is when a bone is connected to the other bone, This other bone is epiphysis, that is diaphysis. So, when a bone is connected to the other bone with a plate of the hyaline cartilage, like this is the growth plate is hyaline cartilage. So, this growth plate, which is the hyaline cartilage, is connecting one bone with the other bone. This is the epiphysis diaphysis joint, and that epiphysis diaphysis joint is a synchondrosis, or it is a primary cartilaginous joint. It is immobile. It is immobile. So, these type of joints are immobile. Synchondrosis or primary cartilaginous joints are immobile, they don't move. Later in the adult, they will be fused to become synostosis. What is synostosis? That is bony fusion. When will be there bony fusion? When you have disappearance of growth plate. So, when the growth plate will disappear, there will be bony fusion, and synchondrosis will change into synostosis because the cartilage will disappear. Now, as you are talking about the secondary cartilaginous joint, this is symphysis. Let us look at the structure of symphysis, but before you talk about symphysis secondary cartilaginous joint, you have to give some examples like you see, this is the diagram for symphysis. You see some intervertebral disc along with pubis symphysis. If you say pubis symphysis is a symphysis, remember it is slightly mobile joint, become more mobile during term pregnancy. So, pubis symphysis slightly mobile, become more mobile during term pregnancy. Why? Because you have to deliver the baby through the pelvis. So, it become more mobile. It is usually slightly mobile. And what about this joint here? This is intervertebral disc. This is the midline intervertebral joint, and midline intervertebral joint is also a symphysis, slightly mobile joint. For example, there is the sacrococcygeal joint, which is also a midline joint, and it is also a symphysis. Let us draw a diagram for sacrococcygeal joint then, working like a symphysis. If you are talking about the sacrococcygeal joint working like a symphysis, draw the diagram for the structure of symphysis. Actually, as you say, this is the sacrum bone and there will be the coccyx bone making sacrococcygeal joint. You will find that the sacrum bone itself is lined by some hyaline cartilage, and the coccyx bone is lined by hyaline cartilage because they all develop in the hyaline cartilage by endochondral ossification. The vertebra, they develop in the hyaline cartilage by endochondral ossification. So, there was some hyaline cartilage on sacrum and coccyx, and what is between the two? Between the two we have intervertebral disc. And what is the intervertebral disc made up of? Intervertebral disc is made up of fibrocartilage. Fibrocartilage. It is like a shock absorber, if you remember. We are putting some shock absorbers between the bones, if you remember. So, intervertebral disc is a fibrocartilage and it is working like a shock absorber and sandwich between the two bones. Actually, this structure is bone separated by hyaline plus some fibrocartilage. This is how you describe a symphysis. Symphysis is a structure where the two bones are united by hyaline cartilage plus fibrocartilage. So, hyaline cartilage plus fibrocartilage together holding the two bones together is a symphysis. It is secondary cartilaginous joint, and secondary cartilaginous joints are slightly mobile joint. They become more mobile during term pregnancy. Even sacrococcygeal joint become more mobile during term pregnancy because you have to widen the pelvis to deliver the head of the baby through the pelvis. Parturition, it must be mobile. Pelvis must be mobile in term pregnancy. Usually they are slightly mobile. So, as we have said that joints are classified by various methods, but one is depending upon the freedom of mobility. As you describe the freedom of mobility, you will see there are fibrous joints which have restricted mobility, there are cartilaginous joint with restricted mobility, but the synovial joints are freely mobile joint. Now, when you say synovial joints are freely mobile joint, we will discuss them separately, but these two have restricted mobility, maybe the fibrous or the cartilaginous. Fibrous itself is three types. What are the three types of fibrous then? As you are talking about the three type of fibrous joint which have restricted mobility, there was the suture in the skull and gomphosis. What is gomphosis? It is the tooth and socket joint in the skull. Now, both of these are in the skull and they are immobile joint. They are immobile joints. Third is actually called as the syndesmosis. You know what is desmos? Desmos is fibrous joint. It's a fibrous joint. Now, when you say that syndesmosis is a fibrous joint and desmos refers to fibers, examples? Examples of syndesmosis we have seen, one is the inferior tibiofibular joint and the other was the middle radio-ulnar joint, if you remember, slightly mobile joints, slightly mobile joints. Now, when you are talking about slightly mobile joints which are inferior tibiofibular joint, there was a question on us, and there's a middle radio-ulnar joint. These are all under the category of syndesmosis. Syndesmosis. What about the cartilaginous variety? Cartilaginous is two types. There is a primary and secondary. If you say primary, it is also called as synchondrosis. Chondro means cartilage, and the other is secondary cartilaginous, which is also called symphysis. Symphysis. So, if you are talking about the cartilaginous variety, it is primary, which is synchondrosis, and it is secondary, which is symphysis. Examples? Examples, synchondrosis, we have taken one example. It was the epiphyseal-diaphyseal joint. If you say epiphyseal-diaphyseal joint is a epiphyseal-diaphyseal joint is a synchondrosis, fine. Is it moving? No, it is immobile joint. That is immobile joint. Now, if you say that epiphyseal-diaphyseal joint is immobile joint, what about these secondary symphysis? They are slightly mobile. For example, we have given the examples like pubis symphysis, or the other was midline intervertebral joint. When you say midline intervertebral joint, one of that was sacrococcygeal joint. So, what about the sacrococcygeal joint? They are slightly mobile like pubis symphysis. When you are talking about secondary cartilaginous joint symphysis, we have taken two examples. One was the pubis symphysis, and which is slightly mobile, and then there was midline intervertebral joint like sacrococcygeal joint is also slightly mobile. Now, what about the synovial joint? Freely mobile joint. As we are talking about synovial joint or freely mobile, we have to discuss them now. This is the next point of discussion. And as you are talking about the synovial, you will find this is one question on examples. It is asking about malleus incus. What do you think the answer is for malleus incus? As we are talking about the malleus and incus joint, synovial. Which synovial? It is saddle synovial. So, if you say malleus incus is synovial and saddle synovial, fine. I will keep the answer as saddle synovial, but we have to discuss some more saddle synovial joints. See, one is, of course, we have discussed the malleus incus, which you will find in the middle ear cavity. So, in the middle ear cavity, you will have malleus and incus synovial joint, which is saddle synovial joint. Can you give some more examples of saddle synovial joint? Yes, of course. See, one is the middle ear cavity where you have malleus incus, it is a saddle synovial. I will tell you one more saddle synovial joint example, and that is the upper limb. What is that in the upper limb? First carpometacarpal joint. If you are talking about the first carpometacarpal joint, that is the one which is working for thumb apposition. Now, I will give you one more example of saddle synovial. It is in the foot, the lateral longitudinal arch. What about the lateral longitudinal arch? Where is the saddle synovial joint? Actually, it is called as the CC joint. What is CC joint? The calcaneo-cuboid joint. Calcaneo-cuboid joint. So, when you say that the calcaneo-cuboid joint in the foot is a saddle synovial joint, we will be discussing this in the lower limb as well later. What we are doing is we are talking about 4 examples of saddle synovial joint. What are they? We have discussed that number 1 was in the middle ear cavity and it was malleus and incus joint. So, malleus incus is in the middle ear cavity and it is a saddle synovial joint. What was the 2, 3? Actually 2, 3 I will tell you in the upper limb. And what is in the upper limb? What is 2? You did not discuss 2, you discuss only 1. Actually sternoclavicular joint also. Sternoclavicular joint is a saddle synovial joint along with the first carpo-metacarpal joint. So, first carpo-metacarpal joint and the sternoclavicular joint in the upper limb are saddle synovial. Yes. What about the lower limb? Lower limb we have discussed the CC joint, which is calcaneo-cuboid joint. This calcaneo-cuboid joint is making lateral longitudinal arch, and when you are talking about the lateral longitudinal arch, there you will have the CC joint, a saddle synovial joint. Now, as you are moving about the details of ellipsoid synovial joint, let us look at the examples. 3 examples we want to discuss, and one of them is the wrist joint. Wrist joint is ellipsoid synovial joint. Let us magnify the diagram and see why it is called ellipsoid, because the articular surface is elliptical. Actually, wrist joint is also called radiocarpal joint. It is between the radius bone and the carpal bone. So, it is called radiocarpal joint and it is having elliptical articular surface. So, that is why it is called ellipsoid synovial joint. And also even the metacarpophalangeal joint, the knuckle joint. This is Gray's anatomy telling you that the radiocarpal wrist joint and metacarpophalangeal joint, the knuckle joint is also ellipsoid. Why you are showing Gray's anatomy here? Because there are controversies. Try to follow Gray's anatomy if possible. So, both of them are ellipsoid. Yes. Can you show me the knuckle joint? Yeah, knuckle joint will show, but even the Atlanto-Occipital joint is ellipsoid. What is this Atlanto-Occipital joint? This is between skull and vertebra, the first vertebra, cervical vertebra. What is this joint doing? It is for the nodding movement, yes movement. So, you mean to say when I move my head for flexion, extension, yes, that is called nodding movement, the yes movement. The skull is moving on the atlas bone. So, when the skull is moving on atlas bone, which part of skull you are talking about? Occipital bone. So, what is the joint called? Atlanto-Occipital joint for yes movement. That is the point here. 3 examples of ellipsoid. Now, when you are talking about the 3 examples of ellipsoid joints, they were 2 in the upper limb. What are the 2 in the upper limb? There was the wrist joint, which is also called as the radiocarpal joint. And number 2, it was the knuckle joint, which is also called as metacarpophalangeal joint. Metacarpophalangeal joint. So, you are mentioning that may it be the wrist joint, the radiocarpal joint, or maybe it is a knuckle joint or metacarpophalangeal joint. They are ellipsoid synovial joint? Yes, according to Gray's anatomy. And what is the third example? Third example was skull vertebra. It was Atlanto-Occipital joint. And when you are talking about the Atlanto-Occipital joint, which is a skull vertebra joint, it is working for yes movement, the nodding movement, and they are ellipsoid. But some books will tell they are not ellipsoid, they are condylar. Now, if they say all the 3 are condylar, they are correct in the way that structurally they are condylar, but functionally they are ellipsoid. So, the point is, some books will say these 3 are ellipsoid, some books will say these 3 are condylar. Which one will you follow? If a question comes giving you both the options, see, any of the 3 examples are given and they are giving the option. Is it ellipsoid or is it condylar? Your first answer should be ellipsoid. If not in the option, then you say, okay, they may be considered as condylar structurally. Structurally, they are condylar. This is second answer, but they are poor example of condylar. Now, if these are the poor example of condylar, then what is the good example of condylar? I'll give you 2 examples. One is the temporomandibular joint, the other is the knee joint. Now, you are telling that these 3 are poor example of condylar, yes, and the good examples of condylar are temporomandibular joint and the knee joint. But then you will realize that some books are telling temporomandibular joint and the knee joint are actually modified hinge joint, and in fact they are also called modified hinge joint. But the point is, if somebody asking you temporomandibular joint or the knee joint, what is going to be your first answer? First you should say they are condylar. If not in the option, then you say they may also be considered as Modified hinge, that is your backup answer, second answer, because they are basically condylar synovial joint. Where do you use such information? Of course, in the exam hall, when the questions come, you get stuck. Controversies. This is to deal with the controversies. See, I am telling you temporomandibular joint is a condylar synovial joint. The knee joint is a condylar synovial joint. Let us magnify the knee joint and see how it is condylar. Actually, it is bicondylar. There are double condyle of femur and double condyle of tibia, bicondylar synovial joint. So, some books will say it is modified hinge also, but the first answer should be condylar, like you see here. Atlanto-Occipital joint is which variety? Is a controversial question. Why? Because there can be two answers. Which one will you choose? Atlanto-Occipital, I'll choose ellipsoid. And what if ellipsoid was not in the option? Then I'll say condylar. So B is a better answer than C. B is a better answer than C.